All right, welcome everybody. Welcome to one of Massage Therapy Foundation's free CE research webinars. And today is on case reports. My name is Adrienne Asta, and I'm proud to serve as the foundation's president. And I want to say a special thank you to Precision Neuromuscular Therapy for their generous sponsorship of today's webinar. If you would like to sponsor a webinar, go ahead and reach out to us either at the end of this or at any time and let us know if you are interested in that. The Massage Therapy Foundation is a nonprofit organization. We're a 501c3. Yes, thank you. Go back one, is a 501c3. Our mission is to advance the knowledge, practice, and scientific bodywork of massage using research, education, and community service. So some of the programs, just a few of the programs we offer here at the foundation: research grants, research conferences, a free online peer-reviewed PubMed Index scientific journal, educational webinars, podcasts, and other materials, as well as community service grants, funding projects to populations that wouldn't otherwise have access. So for more information, visit our website at massagetherapyfoundation.org. It is my distinct pleasure, and I don't know what I did right in my career to be able to be in this moment with this panel of speakers. Robin Miccio is licensed massage therapist. She is actually a case report contest silver winner, and she manages the integrative health program over at the Children's Hospital of Philadelphia. Susan Salvo, Dr. Susan Salvo, she has been practicing for 40 years. I can't believe she started when she was 8 years old. And she is the author of a very well-known book that you may have had in your entry-level program called The Massage Therapy Principles and Practice. So a guide and Mosby's Guides to Pathology for Massage Therapists. Ruth Werner is the author of the very well-known Massage Therapist Guide to Pathology and the host of I Have a Client Who podcast on ABMP. She is an approved continuing education provider and a mentor to a bunch of massage therapists. So without further ado, I'm going to turn it over to Robin to get it started. Thank you so much, ladies, for being here today. I'm really thrilled to talk about today's subject matter.
Thank you so much, Adrienne, for that wonderful introduction. There are no financial interests to be disclosed. And the flow for today, so we're going to talk through the case report guidelines and the process for the first 35 minutes or so, and then we're going to shift over into breakout groups for the Q&A portion. So we can go to the next slide. We are so excited that you're here. We're cheering you on in your journey of writing a case report. And just going to tell you a little bit about the background here. So the Massage Therapy Foundation initiated their case report contest in 2006. And in the more recent years, the contest was really only open to massage therapy students. But as of this year, MTF is reopening the practitioner division. And in the next slide, we'll see that the student and the practitioner divisions will be treated as separate contests with the gold, silver, and bronze awards available for both, along with honorable mentions for each division. Students are eligible to submit to the student contest as long as they are within 1 year of graduating massage school. Submissions for both divisions are due on June 1st of each year, and authors are usually notified by October of that year. So we're going to circle back on the awards at the end. So let's start with what is a case report? So a case report is really a detailed report of a clinician's experience working with a single patient or client. Case reports usually describe an unusual or novel occurrence. And it could be novel in many different ways. So it can be that you're looking at a new massage technique for a common population, or maybe you've experienced an unusual outcome that isn't well known. or maybe you explore a known topic from a unique angle. The point is that the report should really add to the body of literature or add to what we already know to be true about massage based on what is written. And so for that reason, case reports are really great at laying the groundwork for future rigorous research. Before this webinar, we received an excellent question, which was, can you write a retrospective case report? So case reports can be either prospective or retrospective. So when we say prospective, we're talking about the practitioner has an intention of writing a case study in the future about a patient that you're currently working with. So you're actively assessing and documenting, knowing that you're going to write this case report. Retrospective means that we're reporting on an experience that has already happened. And retrospective case reports work really well when the clinician is already actively assessing and documenting naturally as a part of their practice, because those data will be critical for the case report. So that was a great question, wanted to address that here. So as we transition, preparing to write a case report. So here are some highlights. Usually you want to have multiple encounters with a patient. It's recommended that massage be the only new intervention. It's critical that you maintain confidentiality of your client, and keeping their health information protected is of utmost importance. The case report is 2,000 to 4,000 words, with the entire document not exceeding 20 pages. In fact, actually, some of the best case reports are delightfully concise, so keep that in mind. We'll go on to the next slide. So just as practitioners, we should all be practicing massage in an evidence-informed way. So what does that mean? If I have a new patient, let's say with hip dysplasia, as an example, I'm spending time before actually going into that session. I'm spending time looking for information on hip dysplasia and massage for hip dysplasia. So, you're probably doing this already by Googling it, right? You're looking to understand, what is the prognosis? What are the common treatments? Maybe what are the contraindications for massage? What works regarding the massage techniques for this condition? All of this research that you're doing is really more or less what you're going to see in the introduction. And we'll talk a little bit more about the introduction in a bit. As you're kind of gathering that research, it's important to note what assessments are being used in the articles that you're looking at. We're going to talk about how to actually look through peer-reviewed articles. So a lot of the time, published articles include assessments or measurement tools that have been statistically confirmed as valid and reliable. So basically what that means is that tool is measuring what it's supposed to measure, and the measurements are consistent. So as you're doing your research and you're gathering information, you want to really consider what tools are being used in these articles, and potentially use a tool that's already published with your client that you found in the literature. As you're going through the articles, it's also important to note what techniques are being used, especially when the findings are showing that massage was beneficial. So this way, the literature can really help guide your treatment plan. And then when you're writing up what you did with your patient, you would reference those articles in the methods section when discussing the protocol or your implementation process. So let's say you're kind of searching, and there is nothing published about massage therapy for hip dysplasia. That would be a great time to write a case report, because case reports are the most appropriate when you notice that there's a gap in the knowledge about something, and that your case report itself will add new knowledge. The last piece here is we want to talk to our client about the intention to use their story and their data. So authors must receive consent from their clients before they submit. So that's just a little bit of background. Here are the components of a case report. So you have your title, your abstract, introduction, methods, results, discussion, and references. So we're going to review the highlights of each section, but we'll spend a little bit more time on the process of searching the literature and composing the introduction section, because that tends to be the most obscure part of the process for those who are not familiar. Before we kind of dive into that, first of all, I just highly recommend that you just read peer-reviewed articles, published case reports, and research studies to really get familiar with how these are written, what's typically found in these sections. So this is the perfect slide here. So this is kind of, I wanted to walk everyone through how we look for published articles in peer-reviewed journals. So I know we may be tempted to kind of open up our textbook, which can be good, but to be able to actually go into one of these databases and find an article that has been peer reviewed, you're gonna find the most scientifically sound research to support your case study. So there are many online databases that index articles, including PubMed.gov, which you may have heard of. Google Scholar is another database. Note that as you're searching, not every article is open access. So you may not always be able to access the full article. So just keep that in mind. You'll always be able to see the abstract. So if we go to the next slide, once you navigate to your database of choice. In this example, I'm using Google Scholar. You want to type in your search terms, and using the acronym PICO can really help us clinicians focus our search terms. And so if you look at my handy table on the left here, you'll see P in PICO stands for population. So who are you specifically working with? I is intervention. What is the therapy? C is comparison. So if you're interested in understanding whether the intervention is better or worse compared to another. And O is outcome. What are the clinical outcomes you're looking for? And this is usually based on what the patient is telling you their desired outcome is. So for example, reduction in pain. So this is a really great exercise to kind of help focus your search before you actually go ahead and type in those search terms. So if we roll with my other example of hip dysplasia, I come up with some search terms that help me search in Google Scholar. And at the top of the search bar, you see that I use the search terms that I identified during the PICO exercise, and I utilize the and or functions to link the terms together. Recent articles are better. So in this example on the left, I edited the range to focus on the last 10 years. And then just as a note, on the right-hand side, when you see a link, that means that's the full text article. So that's when you're in luck, when you see that. So that's just a little bit of background. When you're doing a search and you're finding that the research is limited, you'll need to really pull something to build your introduction and your rationale. So think outside the box. What might you be able to find from other fields, OT, PT, for example, in your area of interest? As you're going through the research and you're pulling articles, my suggestion is that you organize it somewhere where you can reference it to kind of summarize that into your article. We're going to skip over the abstract section for now because that's usually written last. So we're going to talk about the introduction. So you can go to here, perfect. So generally the introduction includes the topic, the background from the research, and an explanation of why this case report is being written. We talked about a thorough lit review, and the purpose of the case report should be very clear at the very end. So now you've done your research, you've organized it, you want to synthesize it for the readers. So you want to think, you have all your articles, you've read through everything. Based upon all that I've read, what do I know for sure about this topic? And you want to summarize that in your introduction. So we can go to the next slide, and here's an example of the structure of the intro, starting broad and building your case until you reach your ultimate point, which is what is the point of your case report. So next slide will show us a little outline that I developed. Maybe you create an outline. This is just an example. This is, doesn't always have to look like this, but I thought this was a nice prescription for folks that may be newer to the process. So you kind of create yourself a little outline and you fill in the pieces from the articles that you found into that outline. So starting with defining the topic, what condition is it? Why does it occur? What are the symptoms? As you transition towards the point of the triangle, you want to get more specific about what you're examining. What are the current treatments? What's missing in clinical care? Discuss why is the treatment that you're proposing a viable option for this condition? And how will it add to what we already know? So all of that information will support the reason for the case report and lead you to your final statement about the purpose of your case report. So in the next slide, I pulled an example outline from a published case report. I won't spend too much time reading, but I just ask that you take notice of how the author really summarizes the points very nicely, and he references the articles that support his points. He uses his own words to build the background. Next slide, he builds the background to make the case for this case report. He says there's a paucity of evidence supporting the effectiveness of current treatment strategies, and he lists them here. Then he introduces his concept. He builds the rationale for why, and we can go to the next slide. He builds the rationale for why his concept is important. There's continuing education programs that teach dry needling techniques, and he notes that there's a gap in the literature on its effectiveness, and he closes it out with the purpose of the case report. So I just thought that was a really great example. And again, the more you read case reports and published articles, you'll really get a hang for what the flow looks like. So that's really some tips on writing the intro. Now I'm going to pass it over to Susan to talk to us about the methods section.
Hi, guys. I'm going to discuss the methods section as well as the discussion section further on. So if you look at the slide, you'll see the very first area of information is about the client, the demographics, the medical surgical history, their prior treatments and experience with massage contraindications, and whether or not a physician was either consulted or informed, as well as the client's goals. Now, this information can be found on the intake form. So be sure that in your intake form, you might want to revise it to include all this data that you're going to use in this section of your case report. And then you're going to focus a little bit on the outcomes and the measures. So when Robin was talking about the tools, the instruments that's going to be used, very often we see things like a numeric scale, a visual scale, a descriptive scale, something along those lines. And if you, and I did this actually before the webinar, you can actually open up your search engine like Google, and you can put in validity, reliability, and numeric scale, and it'll pop up very, very quickly. So read about it, see if it's valid and reliable, and then cite that source in the section of your paper. And the assessments must be measurable. And so this is why you want to be sure that you're finding something that is valid and reliable. And then you're going to put, why did you choose this instrument? And you're going to link it to the client's goals. So if they say pain reduction, you're going to have a scale that measures pain. So you can do assessment measurements before and after the treatment. So you can see if a change was there or not. If it's range of motion, you have to use like a goniometer. If it's swelling, you have to use some kind of tape measure. So they're all kind of wonderful tools available to you. And if you read a lot of reports, so the read, like Robin said, you're going to be really aware of what's being used and how it's being used. So on the next slide, you need to be able to talk about the intervention. And when I was taking my research, I've done a couple of research studies, and there's something called an operational definition and a conceptual definition. So how are you going to define massage if you're doing your case report about massage? And again, try to use something that you can document. In fact, when I was writing my dissertation, my professor in committee said, you are not allowed to have an opinion until you get to the discussion section. So everything needs to be cited. You know, it can't come from just what you think. So if it's the definition of massage, you can say Smith et al. Said it in 2021, whatever. And it's really kind of fun to read the definitions of things like myofascial release and manual lymphatic drainage, because it really shows you how other authors are also doing their own research for these definitions. And then you're going to talk about your own experience and education in that particular modality. So I was trained here, I've had this much experience, to kind of lay the groundwork about your own expertise. Now, the next bullet talks about the massage environment. Where did you perform the services? Was it, if you're a student, it might have been in the student clinic. If you're a private practitioner, it might be in your home office, it might be in the client residence, it might be in a spa, or it might be at a clinic, like a physical occupational and chiropractic clinic. Talk a little bit about that setting. And then you're going to outline, I call this the recipe section. You're going to outline what you did, how long you did it, how often you did it, the specific techniques, the position of the client. You can talk about the pressure that was used. So there's all kinds of things you can add to this section. And of course, you're going to talk about the rationale, why you chose this particular intervention over others, going back to that PICO, the C in PICO. And then you want to add, if your client is receiving other intervention, other therapies, as well as home care of other service providers for that condition that they have. And of course, you have to be sure that the techniques you're applying, the intervention you're applying, is within your scope of practice for your region and standard of care, and also that you use critical thinking in the whole process. And if you've done a good literature review, that you can say this rationale or this instrument was supported by the literature. And then you want to, even though you're going to have you're going to upload the document where you gain informed consent, hiding the client's name, of course, but you're going to state that you have, oops, I think we move on to the other one. Can you go back just a second? Oh, well, anyway, you're going to state that you received the informed consent from the client in this section. Ready to move on?
So the results section is pretty straightforward. It answers the question, what did you find? So this is where you're going to strictly report the data, both quantitative, which means numerical, and qualitative, the patient experience. Organization is key in this section. So you want to make your outcomes and your measurements really clear. And a great way to do this is by using graphs. But once you have the data in a graph, you don't need to explain it in the actual body of the paper. All of the interpretation for the results section is in the discussion section. So like Susan said, you don't have an opinion about the results, you're just reporting it as is. It's best to refrain from using the term significant, as that relates in research that could be mistaken for statistical significance, which means that you used high-level statistical analyses to find out if the results did or did not occur by chance. So for case reports, we're not using those, so we wouldn't use the term significant here. And then finally, you want to report any adverse or unexpected events here. The next slide, we'll see an example of a graph from a case report done on massage for a patient with migraines and cervical spondylosis. I really like this graph because it's easy to read. It tells the story in a clear way. The labels are clear. I would recommend always having a title to the graph, labeling both axes as well. But overall, I think this was done really well. So I wanted to share that as an example. Okay, so passing it back to Susan to tell us about the discussion section.
Okay, this is my favorite section. You're going to not only summarize, but also interpret your results. So what does that mean? I like to find out what gave you the idea. So when I read something, make it a bit of a narrative. So why'd you think about this idea? And what did you do different? So, and you really can't do this unless you have a good idea of the field. So do a really good literature review for your research study. I'm going to talk about 3 of the ones that I really, really like that blew my mind during this case report committee sessions. So Robin Cunningham in 2011 decided that she was going to do a case report. It had never been done, where she did massage on chemotherapy-induced peripheral neuropathy. And it was fantastic. And that opened up a whole new area of research. It had never been done before. In fact, I think her father gave her the idea. So that was a wonderful example of a condition which they applied massage and it had positive results. A couple of years ago, we also looked at a new population, LGBTQ community, where we read a case report on chest binding for a trans male. Again, a new population, a new idea, a great case report, and what they found with that particular population. And then one more recently was you can even take something that's been known. We have a lot of information about fibromyalgia syndrome. And last year we had one person that said, I really know that the current standard of care is to use medium pressure, but I'm going to challenge that standard and I'm going to apply deep pressure and see what happens. So you can even take a different approach. And so these are just some great ideas. Hopefully I'm stimulating your cerebral juices about the things that you can do and look at these things from a new way. And in this section too, not only do you interpret, but also look at the implications. So why is your study important? What does it change in the big picture of things? So because you're challenging the status quo, challenging new ideas, filling that gap in the literature, you're able to have some fun with this one. So be also, again, you're starting out broadly, and then you're going to come back to that whole big picture idea. Maybe this gives you a new approach. Maybe this gives us a way to understand this condition differently. Maybe now we're looking at massage differently in terms of what it can do for peripheral neuropathy. And I must add that that particular report led to like this randomized controlled trial that was just published about 2 years ago. So I get really excited about this kind of stuff because this stuff is really powerful and we need more people doing more case reports. Be sure that you discuss your limitations, and these are things that you had no control over. Things like participant compliance, things like that. Obviously, it wasn't a randomized controlled trial because it's a case report. That is a limitation. Things like there were no controls. And that is considered a low level of evidence. So be sure you add that to your discussion section. And then you always want to add a little bit about implications for future research. So you might want to say this may warrant a higher level study. And then I think that's all I have for this one. Robin, take it away.
Awesome. Thank you so much, Susan. I'm so inspired. I want to write a case report. Let's see the abstract. So abstract is just a quick snapshot of your article. It's pretty much mirrors the paper. The abstract is going to be publicly available. So it should consist of the key highlights that you want people to know about your article. So that's pretty straightforward. As far as the reference section goes, you just want to read the requirements closely and do exactly what it says. So we can move on to the next slide. I'm going to recommend a great resource, Purdue OWL. I've learned so much from Purdue OWL about writing and references, so highly recommend that for this section. But this one's pretty straightforward as well. And then we can move on to the next slide. Each year, we're looking for case reports that fit the expectations for gold, silver, and bronze. And for case reports that are promising, but may not meet those expectations for an award, a case report may receive honorable mention. Each award is linked to a monetary prize, among other things that you can read here. And it should be noted that Massage Therapy Foundation doesn't always distribute an award. It really depends on whether the submissions met the expectations as outlined in the guidelines. Pretty much everything we talked through today is posted on the Massage Therapy Foundation website under the case report contest. There are all the guidelines really outlined there, so you can always use that as a reference. And then as we conclude, I just want to say that, if writing a case report is something that you're interested in doing, you can do it. It takes persistence. It takes the willingness to challenge yourself, but you can do it. If this process seems daunting, know that another option is to create almost a mini version of your case report and submit it as a poster at a conference like AMTA or IMTRC. So there's always that option, which might be a nice step for you. So thank you everyone for your time. I'm going to pass the mic back over to Adrienne.
Thank you, Robin. That was great. We want people to know what happens in the treatment room. And the case report is that. The case report is our story as practitioners about how we can help shape, like Susan's example was great. And I've actually used that very study to help a client of mine who had CIPN. And, it will only make us better practitioners. So the more case reports we do, the better it's going to be. At the conclusion of this webinar, we are going to have this posted on, it's posted currently on the foundation's website. But at the conclusion, in order to earn your CE credit, you'll find a button there to take a post-webinar quiz in order to earn your CE credit. We are an NCBTMB approved provider, so you will get 1 CE for that. Complete that form to earn the CE, and MTF will provide the certificates of completion upon receipt of a passing score. So without further ado, I think the gold and the richness is going to be in these breakout rooms, so I look forward to seeing all of you there.